Imagine feeling a slight itch in the same place every day, always at the same time. You change your soap, you buy creams, you change the fabric of your clothes. Nothing works. After 60, your body starts talking to you in a different way. Sometimes it whispers, other times it screams, and what seems like a simple itch could be the first cry for help. Now, what if I told you that this itch could be the only early symptom of something that even a blood test can't detect in the first few months? Doctors around the world have warned about areas of the body where persistent itching can hide serious diseases, such as hidden inflammation, liver dysfunction, neuropathies, and even certain silent types of cancer. Worse still, many people ignore it out of embarrassment, thinking it's normal for their age or that it will go away on its own. But today, you'll understand why this tiny sign could save your life if you know how to listen to it in time. In this video, we'll reveal which areas of the body are most dangerous when they itch, which diseases are associated with this symptom, how to differentiate between common itching and an important clinical sign, what to do when it happens to you or someone close to you. And at the end of the video, you will learn about an area of the body that almost no one associates with internal diseases, but which can indicate problems with the liver, blood, or even the pancreas. And believe me, the first area you should look at is precisely the one that almost no one dares to mention. This is perhaps the most ignored area when it comes to itching. It is also one of the most dangerous. Most people over the age of 60 feel uncomfortable talking about itching near the anus or genitals, and out of embarrassment, they end up ignoring it. But what seems like a passing nuisance may be the first sign of anal or vulvar cancer, long before pain, bleeding, or visible changes appear. And that's no exaggeration. According to geriatric doctors, certain types of silent cancer start with just a slight itch, a feeling that gets worse at night and doesn't go away with regular creams or sitz baths. Source: American Cancer Society. Persistent itching is one of the early signs of anal or vulvar carcinoma, especially in patients with a history of chronic local inflammation. Let's look at a real example. I've had hemorrhoids for 30 years. I know exactly what that pain feels like, but this itching, it was different. Words of Julio, 76, retired, living for decades in a quiet town in the countryside. He said the itching came on even when he was sitting quietly watching TV. It was as if tiny needles were slowly piercing his skin. He sought help, tried ointments, took sitz baths, but nothing helped. That's when he decided to seek a second opinion. This time the exam revealed early-stage carcinoma in the anal canal. What saved Julio was the persistence of the symptom and the courage not to ignore it. How can you tell the difference between a common itch and something more serious? If the itching always occurs in the same place, if it gets worse at night or when you're resting, if it does not respond to basic treatments, and especially if there are no visible wounds or bruises, it may not just be dry skin or an allergy. It is an internal warning. It is not easy to talk about it, but cancer does not ask for permission either. What's more, one of the most ignored itches among the elderly occurs in an even more unexpected place, right on top of the head. Many people over the age of 60 live with itchy scalps, sometimes near the nape of the neck, other times behind the ears. And the most common explanation is always the same: dandruff, wrong soap, dry skin. But when this itching persists, appears every day at the same time, or gets worse at night, it may be signaling something that has nothing to do with the scalp itself. According to hematologists, persistent itching in this area can be an early sign of leukemia, a type of cancer that affects the blood and directly impacts the body's inflammatory mechanisms. And why the scalp? Because it is one of the areas with the highest density of nerve endings and blood vessels in the human body. When there is abnormal cell production in the blood, as happens in leukemia, these cells release inflammatory substances that irritate the nerves in the scalp. This causes deep itching, which is not accompanied by dandruff, sores, or visible redness. Let's look at a real case. Don Takashi, 73, a former civil servant, decided to write down every time he felt itchy in a notebook. He noticed a pattern. The discomfort always started at night, worsened when he lay down, and was more intense behind his ears. He changed his shampoo. He used hypoallergenic products. He cut his hair short. Nothing worked. It was only after a more thorough blood test that the diagnosis appeared: early-stage leukemia. The itching was the first sign. No fever, no spots, no pain. How do you know if an itchy scalp deserves attention? If it occurs every day at the same time, if it gets worse at night when you lie down, if it doesn't improve with product changes or mild shampoos, if there is no visible flaking or redness on the skin. A simple tip: gently touch the area where it itches. If it feels warmer than the rest of your scalp, it could be a sign of internal inflammation, not just something superficial. And be aware, some patients also report unusual fatigue, unexplained bruising, or frequent bleeding from the gums as signs that accompany this itching. If this happens, seek medical help urgently. This itch doesn't scream, but it doesn't go away on its own either. And the body insists night after night. And speaking of insistence, there is an itch that appears every day in a fixed spot on the back, and it may indicate an even more hidden problem. There is a type of itch that appears right in the middle of the back, always in the same spot, always with the same intensity, and almost no one associates it with anything serious because there is no redness, no spots, no visible wounds. But this itch may be coming from a totally different place, the pancreas. Although located in the front of the abdomen, the pancreas is connected by nerves to a specific region of the back. When it suffers some kind of inflammation, or even silent changes caused by tumors, these nerves can send signals that manifest as itching. This is what doctors call referred pain, when the problem is in one place, but the discomfort appears in another. This type of itching is different. It is not mild or widespread. It is localized, persistent, and is often accompanied by a feeling of heaviness or deep discomfort, as if something were pressing from the inside out. This was the case for 68-year-old Keiko. She began to feel a constant itch in the middle of her back. She thought it was her mattress. She changed her mattress. She changed her sheets. She cleaned the house thoroughly, got rid of rugs, blankets, and chemical products. Nothing changed. She went to dermatologists, had allergy tests, and underwent several topical treatments, without success. But there was one curious detail. The itching always appeared after dinner, especially after fatty foods. This pattern raised a red flag. After imaging tests, doctors discovered that Ms. Keiko's pancreas was compromised by a silent inflammatory process. And the earliest symptom had been exactly that: itching in the middle of her back. A recent study published in the Journal of Pain Research explains that the activation of intercostal sensory nerves can cause intense skin sensations when there are internal disorders in the pancreas, even before other symptoms appear. How can you identify this type of itching? It appears every day in the same spot on the back. It appears or worsens after meals, especially heavy ones. It does not respond to creams, lotions, or changes in routine. It is accompanied by heaviness, discomfort, or mild nausea, and there are no apparent skin lesions. In addition, signs such as loss of appetite, fatigue, or unexplained weight loss reinforce the warning. These are the types of symptoms that don't immediately grab your attention, but they also don't go away over time. And if you think that's unusual, wait until you find out what itching on your feet or palms might be trying to tell you. Have you ever felt itching on the palms of your hands or the soles of your feet, especially at night, and not understood why? No allergies, no injuries, no cracks, just that persistent sensation, like invisible ants walking under your skin. Well, in many cases, this type of itching does not come from the skin. It comes from within. The hands and feet have one of the highest concentrations of nerve endings and capillaries in the body. When organs such as the liver or kidneys begin to fail, even if only slightly and silently, the body begins to accumulate toxins in the blood. These toxins irritate the peripheral nerves, causing deep and persistent itching. This is one of the earliest ways the body tries to warn us that something is out of whack. Aiko, 70, began experiencing this itching almost every night. It was always the same, on the palms of her hands and the soles of her feet. She changed her soap, used moisturizers, applied ointments. Nothing worked. Her skin looked normal. No wounds, no visible changes. But the discomfort kept her awake at night, and this began to affect her mood, her energy, and even her appetite. When talking to a doctor, she mentioned that she was also more tired than usual and had lost weight without meaning to. A blood test revealed the reason: impaired liver function. Her liver was overworked and the itching was the first sign. This relationship is well documented in medical literature. An article published in Frontiers in Medicine explains that in diseases such as hepatic cholestasis, the accumulation of bile in the bloodstream can activate itching receptors in the extremities of the body, mainly the hands and feet. And what's most frightening is that in most cases, this itching appears before any abdominal pain, jaundice, or visible changes on imaging tests. In other situations, this symptom is linked to kidney problems, diabetic neuropathies, or even deficiencies in vitamins essential to the nervous system. How do you know if this is your case? The itching always appears in the extremities, palms and soles. There are no lesions or apparent inflammation. The symptom worsens at night and does not respond to creams. It is accompanied by fatigue, insomnia, or weight loss. In more advanced cases, tingling, burning, or loss of sensation may occur, indicating possible associated neurological damage. When the symptom comes from within, moisturizer does not work. And the time wasted trying to soothe the skin can cost you the early diagnosis of a much bigger problem. And speaking of subtle symptoms, there is an itch that appears on a part of the body that almost no one notices. And it can be the first sign of a highly aggressive cancer. When it comes to breast cancer, most people think of lumps or lumps, but there is a form of cancer that does not form any lumps. It manifests itself in a much more subtle way, as a persistent, localized itch that doesn't get better with anything. We're talking about inflammatory breast cancer, one of the most aggressive and silent types. And this itch, often ignored, can be the first warning sign. In women, this sensation usually appears just below the breasts or around the nipples. In men, it may appear as a unilateral discomfort near the chest. It is easy to confuse it with an allergy to a bra, heat, or clothing fabric, but this itch has some characteristics that make it different. It does not change location, does not improve with creams, and is accompanied by subtle changes in skin texture, as if the surface were thicker, wrinkled, or orange peel-like. This is what happened to 69-year-old Lucia. She noticed a constant itch under her right breast. She thought it was her bra fabric. She switched to cotton, then to a seamless model. She even tried not wearing anything for a few days, but the itching continued, always in the same place, always at night. No pain, no lump, no wound. When she did a self-exam in the mirror, she noticed that the skin on her right side was different from the left. It was stiffer and slightly swollen. She sought out a breast specialist. The diagnosis came quickly: early-stage inflammatory breast cancer. According to the Brazilian Society of Mastology, this form of cancer accounts for only 1 to 5% of cases, but it tends to progress rapidly. Localized itching is one of the first signs, especially when associated with changes in skin texture. It is important to understand that this type of cancer does not form a palpable lump, which causes many women and men to delay seeking help. How can you tell the difference between this itching and something common, located in only one breast, persistent and resistant to creams, ointments, or changes in clothing, accompanied by skin changes, thickening, redness, or stiffness. There may be an increase in volume on one side, a feeling of warmth, or mild burning self-examination in the mirror is essential. Noticing differences in texture, color, symmetry, and sensitivity can make all the difference between early diagnosis and more aggressive treatment. And be aware, although rarer, breast cancer in men also exists. If you experience persistent itching near your chest, see a specialist. The body warns us, sometimes with pain, other times with a subtle itch. And speaking of subtle warnings, the next symptom is often confused with poor circulation, age, or even varicose veins, but it can hide something much more serious in the lymphatic system. Many people over the age of 60 experience itching on the lower legs, especially at night. They usually blame dry skin, poor circulation, or even tight socks. But in some cases, this persistent, intense, nighttime itching can be the first sign of a more serious problem. Lymphoma, a type of cancer that affects the lymphatic system. Unlike common allergies or irritations, this itching does not spread or change location. It appears every day in the same spot on the legs, almost always on the front, and usually worsens in the early hours of the morning. This is what happened to 75-year-old Carlos. For 3 months, he woke up every day at 3 a.m. with unbearable itching in his left leg. He used moisturizers, applied ointments, and even tried cold compresses. Nothing worked. When he saw a hematologist, tests revealed early-stage lymphoma. According to the Brazilian Hematology Association, persistent, localized itching that is resistant to topical treatment is one of the least recognized but earliest signs of the disease. Other symptoms that may appear alongside it include night sweats, extreme fatigue, and unexplained weight loss. If you experience itching every night in the same area of your leg with no apparent cause and no improvement, don't ignore it. It may be your body trying to react to a more serious internal inflammatory process. And if that surprised you, wait until you understand what an itchy belly button can reveal about your liver, your hormones, or even your lymphatic system. Few people pay attention to their belly button, but persistent itching in this area can be much more than sweat, fungus, or poor hygiene. In some cases, it indicates a buildup of toxins in the blood related to liver, kidney, or metabolic disorders. The belly button is an area of folds and moisture, and therefore especially sensitive to internal imbalances. This is exactly what happened to 68-year-old Teresa. She felt an uncomfortable, deep itch in her belly button, always at night. Her skin appeared normal. She tried antifungal and moisturizing ointments, but the discomfort returned every day. After tests requested by her doctor, a change in liver enzymes was found, indicating liver overload. According to researchers at the University of Tokyo, the skin of the belly button can show early skin signs linked to liver and lymphatic system dysfunction, especially in older people. How can you recognize it? Persistent itching localized in the navel skin appears normal, with no discharge or inflammation, worsens at night with no improvement with topical treatments, presence of fatigue, loss of appetite, or mild abdominal swelling. If itching in the navel does not respond to basic care and appears along with other subtle signs, it is time to investigate. It is a small area, but it may be revealing something much bigger. And now that you know these 7 areas of the body that speak before disease strikes, it's time to tie it all together in a practical conclusion. Itching happens. Most of the time, they are temporary and harmless. But as we saw in this video, there are situations where a simple itch can be the first sign that something inside the body is asking for attention. And that's the key point. The body speaks, always. Sometimes with subtle, repetitive, silent symptoms. but they appear before any pain or abnormal test results. Our goal here is not to scare you, it is to inform you, because the sooner we identify these signs, the better chance we have to act calmly and efficiently. Today, you learned about 7 areas of the body where persistent itching can be more than just a skin nuisance. And you understand that observing, recording, and seeking medical advice is not an exaggeration. It is taking care of your own life. Information is freedom. It is autonomy. It is being able to choose the best path before urgency chooses for you. If this video helped you in any way, share it with someone who also needs to know these signs. Like, subscribe to the channel, and turn on the bell. That way, you won't miss the next videos, which are always scientifically based, accessible, and focused on quality of life. And if you or someone close to you has experienced any of these itches, tell us in the comments. Your story may open other people's eyes too. Health is built on details, and sometimes it all starts with an itch that no one thought was important until now. See you in the next video.